Hi, welcome to Rotemberg Plastic Surgery. I'm Dr. Baotram Tran.
I'm Silvia Rotemberg, and we're here today to talk about breast implant explantations. I think that we are plastic surgeons, and we were trained to place breast implants on patients for breast augmentation for cosmetic reasons, but we were also trained to remove those implants.
Right.
And I think that we try to treat each patient individually. So I don't think that we should be against breast implants if we have a set of patients that do have problems with breast implants. I don't think we should discriminate the patients that do want to have breast implants. I think that there is nowadays there's a trend, or maybe because there are more female plastic surgeons,
Right.
and we do actually listen to the patient.
Mm-hmm.
And some patients, they do complain that they have systemic symptoms. They have fatigue, they have depression, they have headaches, they have rash, they have itching, they have a lot of symptoms that and they believe it's from their breast implants because they had enough tests
And workup.
and everything came back
Right.
negative. There's nothing wrong with them, and they just have the breast implant. So I think that we as female physicians, we listen to them, right?
Right, absolutely.
Yes.
So I think in patients, obviously everyone is different. So just because an implant works well for one patient, that doesn't mean that somebody else's body can tolerate it well. So I think in that sense, it makes sense that if this person doesn't do well with the implant and they want it removed, there's no reason why that shouldn't be done for them.
Right. And the way we remove, we do an bloc capsulectomy, and we, as long as your body, your anatomy, the age of the implant also plays a big role on the procedure, and you will have a longer scar when we do an bloc capsulectomy.
Right.
But even if we don't do, sometimes we cannot remove that implant on the bloc. Okay, bloc capsulectomy, what does that mean? It means that we make a cut on your skin, we open the tissue, we separate the breast tissue from the capsule of the implant, and we pull everything out. We pull the capsule with the implant inside. The implant doesn't touch your body. Okay. Sometimes, if that implant is ruptured or if that capsule is extremely thin, sometimes it's impossible to do an bloc capsulectomy.
Right. But that doesn't mean we don't remove everything completely. We do, which means that if the capsule is very thin, what we would need to do, because the capsule tends to rip when that happened during the process of trying to separate it from the rest of your body, we remove the implant first, and then we remove the rest of the tissue that used to surround the implant or the capsule. So it is a complete removal of all the tissue that has been touching the implant.
Right.
It just means that it didn't come out everything in one block. It means that we take the implant out and then we remove the whole entire capsule.
But we always do a total capsulectomy.
Right.
Not only for those patients, but even for patients that do have rupture implants,
right.
that they don't have any symptoms with breast implant illness. Every patient that has a rupture implant, we do a total capsulectomy. We remove the total capsule of that patient, so there's no capsule behind.
Right. And we also do that for patients who have what we call capsular contracture, or a very firm scar around their implant.
Right.
So it's the same, similar procedure.
Correct. And the other thing is, once in a while, there are patients where the capsule attached to the rib cage, okay, to the
Right.
chest wall, is extremely thin.
Mm-hmm.
And if we're removing it, sometimes it gets very close. We're right on top of the rib, and if there is, there's always a risk that if we try to take a little bit deeper, we're gonna go inside your chest wall, meaning we can actually puncture a hole in your lungs.
Yeah, and that can
And
be,
that's not good.
that's not safe. So, but regardless, we still, in a way, remove that tissue because we use the electric cautery. Basically, we burn off the capsule from that in that area. Usually, it's a very small spot, you know, that we can't remove completely. So we do burn that tissue off. So it doesn't come out, but it gets removed by basically desiccations by the electric cautery. Yeah.
Right. So everything is clear, and then of course, you know, we irrigate, we wash that tissue with a lot of antibiotic irrigation with betadine solution, and that to clean, and we check for any residual silicone. If there's anything extra that we see, we look in the armpit, and then it depends if the patient wants to have a breast lift at the same time. We can do a breast lift at the same time. Some patients opt not to do anything, so we basically just close the wound, and we do have to place a drain just because you used to have a large space, and now we empty that space, so that space there will collect a lot of fluid. So that's why a drain is very important, but usually just stays for
a week.
Yeah, about a week.
Yeah, I think so. And then we mentioned the breast lift. Some patients opt not to have it done at the same time, like we mentioned, and then some patients just wait until to see how much that tissue retract, and some patients want a breast lift done later on. It doesn't, it doesn't mean that you can't get a breast lift done later.
Right,
well.
And some patients also, depending on the size of your breast, we can also do fat transfer to the breast to give you a little bit of volume, right?
Yeah, because as you can imagine, with the breast implant, everything kind of get pushed out. So once we remove it, it's kind of like a balloon, so it deflated down. So your breast is gonna be a little more droopy. Yeah. So in order to help correct that droopiness and give you a fuller volume, fat grafting can be done.
Yeah, we can do one session right after the procedure, and then we can do a few months later another session, because with fat grafting, 50% of the fat will be reabsorbed, so you're not going to have that optimal result, but it can be done later to get the size that the patient wants. So the recovery for those patients
is pretty easy, actually. So you have the incisions under the breast to care for. Usually no heavy lifting for about 4 weeks, no submersion in water for 4 weeks to allow it to heal up completely, but other than that,
the patients, they do really well. Some patients, they have relief of those symptoms right after surgery. We've had patients that said that their migraine improved the same day after surgery, and they had to use less of their migraine medication. And also some patients, they say that a lot of their symptoms improved. So they have a much happier life after the explantation.
Right. I think a lot of patients mention chest tightness. They feel like the tightness, so their chest is gone, so they can breathe better.
Yes, and they can sleep better also. Right. So I mean, it's a procedure that it should be carefully selected to the right patient. Right. So if you have some of those symptoms, don't be afraid to discuss with your doctor, or find a doctor that will listen to your symptoms, because it's not, breast implant illness is true for a lot of patients. Yeah, so we don't, obviously there's patient selection, so we have to make sure that our patient go through the process of extensive workup, making sure that everything is okay, that they don't have any other medical problem that can contribute to their symptoms before we would recommend undergoing the process of having your implant removed. If you have any other questions about breast implant removal,
let us know by emailing us or calling us, and we'll be happy to provide you with the answer.
Yes.